Hello students, welcome to FMT PYQ series. Today's important topic is drowning. We'll do its mechanism and autopsy both. So what is drowning? See, drowning is a form of asphyxia resulting from aspiration of fluid into the air passages due to submersion in water or other liquid. Aspiration simply means going inside, pilana. Mechanism of drowning is initial breath followed by involuntary inspiration. Basically, whenever a person is drowning or in the water, he first tries to hold his breath for as long as he can, but after a certain period it becomes impossible, and even without his controlling, there is inspiration by the body just gives up. And what happens that because of that, aspiration of water goes into airways, because mouth and nose everywhere is open and water goes inside, which leads to formation of fine froth in air passages, because in air passages in the respiratory system, mucus is already there. So water plus mucus plus air and mixture of all three causes formation of fine froth. However, body gaseous exchange is impaired, which leads to hypoxia. And as the time passes, hypoxia leads to loss of consciousness, which leads to cardiac arrest and death. So it takes some time, but the mechanism is that. So what will you find in the autopsy? The autopsy part is very important, because rest drowning mechanism, you would have be able to write it. What would you find? External findings: fine, white, persistent froth at mouth and nostrils, which is because of water, mucus, air, all three mixture. And the clothes would be wet and there will be presence of weeds or mud. Then, most important, you would find cutis and serina, which is a goose skin appearance called simply goosebumps. But what is the medical knowledge? See, there are tiny muscles at the base of each hair follicle, which are called erector pili. These erector pili contract and pull the hair upright, causing the skin around that hair follicle to bunch up. So it feels like goosebumps. Also, you would get washerwoman's hand and feet. Basically, due to a lot of time being submerged in the water, the skin will start wrinkling. And you might have noticed, suppose you're doing a household chore or cleaning, washing clothes, after some times you will find your fingertips become rubbery. So that happens all over and this is called washerwoman's woman. Internal level, what you will find lung voluminous and balloon, which is called emphysema aquosum. See, basically what happens is that the lungs becomes overinflated with a mixture of air and water, leading to very distinct look. When we see on the autopsy table, you would be easily able to identify that this person has drowned. Okay, so emphysema aquosum, you will find frothy fluid in trachea and bronchi, because there is a surfactant present in the trachea and bronchi which maintains surface tension. So whenever water goes inside, water plus the surfactant plus air will cause a fruity fluid. Water in stomach, you will find if the person has been gasping, and you would simultaneously find Paltauf's hemorrhages or subpleural hemorrhages. Emphysema aquosum you will find on the outer side, and Paltauf's hemorrhages you will find on the inside side. What are these? These are the small reddish brown hemorrhages that appear on the surface of the lungs. So when we do the examination of the lungs, you will find this, and presence of diatoms in bone marrow, which gives the confirmatory test. What is the medical legal importance? See, it really helps in differentiating between antemortem drowning from postmortem emission. Basically, simply means that a person might be killed and then his body would be submerged in the water, so and so, to make it look like accidental drowning. Homicide looking making look like a suicide. Also, diatom test supports very big diagnosis, and most cases are accidental. Some may be suicidal or really homicidal. Basically, a person was looking over the bridge, you might have seen, fine, was traveling, and he by mistake jumps down, does not know swim, gets panicked, and these all things happen. Okay, see you in the next topic. Thank